In this small talk, we discussed the letter by Vlachopoulos to the Journal of the American College of Radiology. In this letter, Vlachopoulos reports the results of a crossover study investigating the impact of the electronic cigarette vaping on aortic stiffness and blood pressure. Aortic stiffness and blood pressure are both predictors of cardiovascular risk. So 24 smokers, young adult smokers, are recruited for this crossover study, which consists of 4 arms. The 4 arms or treatments are smoking a single tobacco cigarette, vaping an electronic cigarette with the same nicotine content for just 5 minutes, vaping the electronic cigarette for 30 minutes, and using a sham cigarette for about 1 hour. The sham cigarette is an electronic cigarette without cartridge, so it doesn't contain nicotine nor e-juice. And they found out in the study that heart rate, blood pressure, and aortic stiffness are transiently increased, not just by smoking the tobacco cigarette, but also by vaping the electronic cigarette for 30 minutes. And in particular, blood pressure and aortic stiffness are also increased temporarily by just vaping for 5 minutes. Before going on with the paper, I would like to clarify what aortic stiffness stands for. So aortic stiffness is literally the stiffness of the aorta, and the aorta is the main artery of the human body, and it carries oxygenated blood from the left ventricle to the rest of the body. This sketch shows the structure of the vessel walls. Arteries are vessels that carry oxygenated blood from the heart to the rest of the body, except for the pulmonary artery. Veins are vessels that carry deoxygenated blood from the rest of the body to the heart, except for the pulmonary vein. But both share the same composition of the vessel walls. This wall is made up to 3 layers, which are: the outermost is the connective tissue or tunica externa. The intermediate one is tunica media, and it's made of smooth muscle cells and elastic fibers. And the innermost layer is the endothelium, also called tunica interna. The artery presents a thicker intermediate layer, which contains more elastic fibers that allow the artery to dilate in the presence of high blood flow. So the stiffening doesn't pertain just to the aorta, but it's a phenomenon occurring in other arteries and also in the veins, as recently shown by Farquhar and the Delaware University. And so, due to the physiological aging, these vessels get stiffer. And I won't go into further details, but the reasons why this happens are explained nicely in this review in Applied Physiology journal. Here we introduce the Young modulus E. The Young modulus is used to measure the stiffness of an object, and it is defined as the ratio between the stress and the strain of the object, strain or deformation. So the stress can be computed as the ratio between the force and the surface where this force exerts, and the denominator is the ratio between the deformation and the original length of the object. We are giving this example for simple uniaxial tensile force. So if we have this force here applied to this object, if the object has a low stiffness, there will be a larger deformation compared to an object with the high stiffness, which is less elastic. Changes in vessel wall stiffness are caused not just by physiological aging, but also by a disease called atherosclerosis. Atherosclerosis literally is the formation of plaques along the vessel wall. And these plaques, by building up, they end up to reduce the vessel lumen. But what happens at the early stages is that there is a remodeling of the vessel walls known as the Glagoff phenomenon. Because of this phenomenon, the actual lumen of the vessel doesn't really change at the early stages of the atherosclerosis. So if I try to assess the extent of this disease or the presence of this disease with a conventional angiography method, which aims at measuring the vessel lumen, I may not be sensitive to the early stages of this disease. Whereas, as explained in this nice review by Wentland, pulse wave velocity proves to be a sensitive biomarker of arterial stiffness and of the early stages of atherosclerosis. And this is because within its definition, pulse wave velocity doesn't contain just the thickness of the vessel wall or the radius of the vessel, but it contains also the Young modulus or the elastic modulus. So it is directly related to the stiffness of the vessel. And pulse wave velocity it's clinically measured with the techniques called the applanation tonometry or Doppler ultrasounds, but it can be also measured with the flow sensitive sequence using MRI. Applanation tonometry measures pulse wave velocity by using pressure sensors. The pulse wave velocity is measured as the ratio between the space and the interval time. And by interval time, we mean here the temporal delay between two pressure waves recorded at the carotid and femoral level. In this paper by Dupis, pulse wave velocity is measured in a group of healthy people, young adults, with normal values of systolic blood pressure and normal heart rate and normal body mass index. And the average pulse wave velocity is about between 6 and 7 meters per second. Now that we have clarified some concepts, let's go back to the discussion of Vlachopoulos' letter. So the crossover study was built up with these 4 treatments, and 24 smokers were asked to smoke a tobacco cigarette, vape an electronic cigarette for either 5 minutes or 30 minutes, and smoke a sham cigarette which contained no nicotine and no e-juice. The aortic stiffness was here assessed by means of carotid-femoral pulse wave velocity measurement. The effects of the tobacco, cigarette smoking, and electronic cigarette vaping were referred to the sham treatment, and these are the indications about the statistical analysis. So the differences between pre and post within its treatment were assessed with the use of pair t-tests, and pair t-tests were used to assess differences between the 4 treatments or arms of the study. ANOVA with repeated measurement was used to compute the composite effects of the treatments versus sham over time. And in the analysis of pulse wave velocity, the blood pressure was used as a covariate to account for composite effects over time too. The results are shown in the letter by these 2 graphs. So they measured the blood pressure and pulse wave velocity and heart rate too with respect to the sham treatment. So they used the sham treatment, so the fake cigarette, as a baseline value. And here they show the difference between each value measured at a certain time point with respect to the baseline. So they found an increase in systolic blood pressure, which was paralleled by diastolic blood pressure, as they state in the paper. And they also found an increase in pulse wave velocity. This increase was transient, meaning that after a certain amount of time, the value came back to the baseline. So for what concerns systolic blood pressure, they found that the increase was significant for the with respect to the baseline for the tobacco cigarette smoking, as well as for the e-cigarette vaping, no matter the duration of the vaping session. And they also found an increase in heart rate, but just for the tobacco cigarette smoking and for the cigarette vaping for 30 minutes. Regarding the pulse wave velocity, they found an early increase in pulse wave velocity for the tobacco cigarette, whereas the increase due to e-cigarette vaping was a bit delayed, so the peak was a bit delayed. And this increase was significant for every time point with respect to the baseline. For the 5-minute session of e-cigarette vaping, it was significant just for the 15-minute time point. So it means that the increase was, we can say, delayed after 5 minutes of e-cigarette vaping. And the authors explained this delayed transient increase to the fact that with the cigarette vapor, the nicotine delivery through blood is lower, and the blood peak is reached later compared to tobacco smoking. So in this letter, they show that there is a transient increase in blood pressure and pulse wave velocity, which suggests a transient increase in aortic stiffness. But we don't know if this is due to the presence of nicotine. And thank you for watching e-cigarette small talks.